Hello, and good evening, and welcome back to our channel. I'm very formal today.
You are. Good evening. The sun's out, and she's saying good evening. Good evening. Here is the weather.
I'm trying to be professional for a change, and it's clearly not working because this is the response that I get when I try and be professional. This is part. Now it's really throwing me off. Part 9 of our 10-part series. Jeez Louise, I can't talk today. 10-part series of our pregnancy journey. And so we're coming to the end really of our journey. It's been a long journey for those 10 people who have been on the journey with us. If you could do us a favour and like or subscribe to our YouTube channel, it would be really helpful because we're trying to spread the message. And I'm Christabel Samy from Samy Medical, and
and I'm Norafiah.
Now, Norafiah is an amazing midwife who works with us at Samy Medical and in private practice. And as usual, we're just giving you some general advice and talking points. We want you guys to start conversations and start getting a little bit more involved about, what choices and decisions we're making through pregnancy. So we're not designed to take over and give you medical advice. It's just talking points to be able to discuss that with your own healthcare professional. Yeah. And today we've got a little bit of a, could I say controversial topic?
Possibly
controversial.
It should be on the radar though.
And so we want to talk a bit about informed consent.
Yes.
And so Norafiah, why don't you kick us off?
And I guess to informed consent is very important because throughout your whole pregnancy journey, and particularly in your labour and birth, it's really important that you understand what it is, like procedure or recommendation that's been offered to you, and the pros and cons of it. The benefits. What's the risk to you and baby.
And we've talked about this for those of you who have been following our journey. We have touched on this in quite a few of the videos. At each step, we're talking about, whether you want to have painkillers, do you want to have screening tests? Which screening test do you want to have? Do you want to have the glucose tolerance test?
That's right.
We've talked and touched on, making the right decision for you and your family.
And understanding how it impacts, for you through the pregnancy, the decisions you make when you go into labour, and then afterwards, implication to yourself and to baby as well. And I guess and the reason we're bringing this up is because globally, like everybody knows about the postnatal depression rates. Is rising or is quite high. It affects a lot of women. Post-traumatic stress disorders as well, and particularly for partners, is also like a
big thing. And what I have to say, as a GP and probably as a midwife, Norafiah has seen this a lot, but you guys at home might be thinking, what are we really talking about? Yes, we're talking about your postnatal depression, which I think most people would know about. Mums having either the baby blues or something a little bit more significant or serious. But there is a lot we see where you've had a bad birth experience with your first child, and that does carry forward into future deliveries. It sometimes affects whether women will actually have or want to start trying for another baby. Or a lot of their maternal health as they're going through that pregnancy. So I've seen women who really don't engage as well with their next pregnancy or seem a little bit disconnected from the whole process. I think you would agree.
And even to their babies as well.
And that can actually stem from because we've not actually addressed some of the PTSD, the post-traumatic stress from the event of the first child.
Yes, exactly.
So if there was bleeding, if we had to go for an emergency C-section, whatever it might be.
And it's unfortunate that for a lot of women, like they go through like a traumatic experience, like through their labour and birth, and then when they reflect and then like take it all apart, they find out that certain things weren't necessary that was offered or recommended in their labour or birth.
Or even if they were necessary, they didn't have any discussion.
They didn't have any discussion around it.
It might have been something that occurred that was actually above board, was what should have happened or what was good to happen. But if you don't know that, in your head you can make it bigger, can't you? If you don't know that it was supposed to happen that way.
Absolutely. And that's the thing, that's the point around the informed consent is first and foremost, women need to understand that you have body autonomy. And it's a human right for you to make your own decision about what happens to you and your body. But it's interesting how what I've noticed anyway, like women kind of give their power away or their authority away because, it's a doctor or it's a midwife or whatever. And so, like we would routinely offer whatever, a screening or some sort of procedure. and the women will just kind of go along with it, even though they sort of feel like, oh, that doesn't really feel right for me. I don't really understand that, but they don't actually.
Yeah. People don't really question it.
Yeah, they don't question
and I am going to say the elephant in the room probably as well. I don't know if that's the right way to say it, but anyway, I'm going to say it. Obstetrics, or anyway in WA or in Australia, is still a very male-dominated field.
Yes.
And I do have some women who say to me, I just felt a little bit uncomfortable questioning it or, sort of saying it. And I think it's important to realise that, yes, that it is a very male-dominated field. And so, you shouldn't feel like you can't ask those questions or you can't say, hang on, what are we doing?
Yeah, and you need to exercise your right to either change doctors, or in a hospital setting, ask for female doctors, because to me, birth and labour, that's a female area, right? And you can't help but be a feminist when you're in the the field of labour and midwifery and
also but I will say from the hospital point of view, probably we sometimes don't have enough female doctors.
Exactly.
More ladies need to go to medical school or train to be midwives and things like that. So sometimes it's not always possible. Rural locations, WA's got a huge rural location geography, and that's not always going to be possible.
No.
But where it's not possible, it's just being comfortable with the number of internal examinations that you're having, or who's in the room while an internal examination is happening, and all of that sort of stuff.
So you have a right to say how many people are in the room with you, who actually performs the procedure as well. And sometimes, if the male doctor is the most qualified to do it, then sometimes you might just have to accept that. But informed consent, so you need to make sure that whatever is being offered to you, you understand what it's all about. And not just somebody coming in going, hey, we need to do this now, and you kind of go, oh, okay. So informed consent is actually, what is the procedure? This is the risk, this is the benefits, this is how it's going to impact this is why we're doing it. And then it's a case of you deciding, do I actually want that done or not?
And nothing is a rush. Even in the midst of delivery and labour, you can just go, hang on, I'm not comfortable to make this decision right now. Let's just do it. Yes, you might get some fallout from that, but you just stand your ground. And we're harping on about this because we are seeing a lot of women in subsequent pregnancies having had issues that they didn't address at the time. And so we're wanting to help you guys enjoy your pregnancy and your delivery and have a great birth story that you can tell people, rather than have a story where you just want to forget it and just look at this baby and just want to block it all out.
Exactly.
Because it's a really happy time, so you don't want to be negative.
Absolutely. And it's important to validate women's experiences or the feelings around, and it could be from the outset it might be just appear like a normal lovely sore birth, but at any point in the journey, if you're feeling disrespected, and because as health professionals sometimes you don't know a woman's previous history, because she chooses not to disclose. So if there's any kind of sexual assault or any sort of violence like that, it's even more important if you haven't disclosed that to your care provider, that not that you have to disclose everything, but just to kind of say, actually, let's just slow down, or can I get another person, or I need a midwife in the room, or whatever's going to make you feel comfortable. Basically,
is the way to do it. And actually, we're giving the men a bad rep here if you're an obstetrician. But some women, and I am going to say this because I do a lot of pap smears, cervical screening for women. I do have a lot of women who say that they prefer if a male does it because they're more gentle. So your preference may actually be to have a male doctor do something. So and we've everyone has got to feel comfortable. I've had a lot of women who say that when they have female doctors, not me because I'm the pap smear queen, so they're always really surprised at how good I am. But they have said, actually, loads of women have said to me that the worst pap smears they've ever had have been from females, because they're maybe not as empathic about what is happening, and they're a bit forceful. But I can tell you, I've had lots of women say that to me.
Or they just don't like vaginas.
I don't know. I'm not really sure. So a few women have said that their best pap smears have been from male GPs because they've been gentler and slower and maybe more communicative. Maybe because they're a bit nervous. So I'm not really sure. So we're not being sexist here.
No.
We're just saying if you have preferences at any stage, it's about vocalizing and making that choice.
Yeah, absolutely.
And this whole concept is quite topical at the moment of obstetric violence, which if you're like me, you kind of probably thought that happened in other countries, and you thought that surely doesn't happen in Australia.
Yeah.
But we're just sort of, I think briefly we should just touch on the fact that it is a concept that is important even for Australia.
Yeah, and violence isn't necessarily like physical.
Yeah.
It's also emotional.
Yeah.
If you feel coerced or bullied, or if you're treated roughly.
Yeah. And the biggest example of obstetric violence that does unfortunately happen in Australia is with having unnecessary tests or birth options. So the biggest example is actually C-sections.
Yes. Yeah.
So WA actually has one of the highest C-section rates. So does Australia, to be fair, across the country with what the World Health Organisation.
Yes, I think the World Health says it should be at 15%.
Yeah, and we're currently, I think WA, this was the latest fact I could find, was from 2018. Our figure is 37.8%, and it was higher in certain hospitals of WA. And so, sometimes it doesn't, no one would say having a C-section is a form of obstetric violence. You wouldn't have thought, but actually it is. Yeah. So it's just about sort of being more aware of that and having an unnecessary C-section.
Yes.
If it's needed, fair enough, but if it's not needed and it's a decision based on convenience, timing, money, or any of those sort of factors, then that's going to have ramifications for future pregnancies.
Absolutely.
And your experience. And who wants to have a C-section if you don't have to have one?
Yeah, exactly.
Because you can't drive anywhere. And who wants to be
it is major abdominal surgery. That it's not like
and you've got a scar. You can't drive anywhere. It's actually quite painful. Women forget that it is actually very painful after.
Excessive bleeding.
Yeah. So if it's necessary, definitely have it. But, not just because it's convenient, because the doctor didn't want to come in, because we can bill more money, those sorts of things. So I think we just wanted to touch briefly on that point.
Yeah.
So that is part 9 of our pregnancy journey. Part 10 is going to hit next week. So do us a favour, like, subscribe, share. Please help us out. Just feel bad for us because we're still doing these videos if all else fails.
Last one though. Last one.
Woo! Good night.
Good night.